Hi, doctors. Today we have a very different format for our Doctors Forum because we have a very special guest, and I think this will be very useful for all the practitioners, medical practitioners, from doctors to support adjunct therapy practitioners. So I'd like to welcome our guest today, Dr. Jansen Kalalan. Dr. Jansen is a specialist in the area of lifestyle medicine, and he focuses on supporting cancer patients. Dr. Jansen, welcome.
Hi, hello Sean, hello doctors. Glad to be here.
Doc, you've supported many cancer patients. What are the different types of cancer patients that you have treated over the last few years?
I have treated a lot of breast cancer patients, colorectal cancer. I have encountered leukemia patients. Some of the more rare cancers that I have encountered were adenocystic sarcoma. Some were even rhabdomyosarcoma I've had encountered. Colorectal cancer, yeah, I already mentioned colorectal.
Yes.
Lung cancer as
Wow.
well. So there are prostate cancer as well. So there are quite a lot already.
Pretty much all across the board. So your experience is really good. Doc, also the range of the patients that you've taken care of and treated, I believe they range from toddler all the way to the elderly, right?
Yes,
So what's your youngest and your oldest patient?
the youngest patient that I have had was a 36-month-old baby girl.
Baby girl, 36
Yeah,
months.
36-month-old.
I think I know this one. Is it baby Jian?
Yeah, it is baby Gian.
Yeah, maybe you could tell us a little bit about what happened to baby Jian, what was her condition, and what's the final result.
Yeah. Gian was 36 weeks old when I first encountered her. Her case was a hepatoblastoma. So it's quite rare. It's a liver cancer, but more specifically found in babies. Yeah. So she have had it since she was a fetus inside her mom.
Oh wow, she was born with it.
So when her mom gave birth to baby Gian, Gian underwent a lot of cycles of chemotherapy. Now,
As a toddler.
yeah, as a baby,
As
an
a
infant,
baby,
as
as
an
an
infant,
infant,
yeah,
okay.
she underwent at least 18 cycles of chemo.
Wow, I did not
Yes.
know this. Okay.
So afterwards, they were trying to shrink the tumor. However, the tumor is quite spread already. So the surgeon was actually contemplating on operating on Gian. However, since she is still quite young,
yes.
we were trying to wait. We're waiting for her to grow up a little bit so that
Yes.
her liver grows a bit more, so
Yeah.
that it would be easier to resect.
operate, right?
Yeah, easier to operate.
Yeah.
So while waiting, that is when the
They came to you.
Yeah, that is when they came to me.
Yes.
So at that time, I was quite reluctant actually on treating Gian because number one, hepatoblastoma is rare. It is super rare. It's one of the rarest cancers in the world. Actually, here in the Philippines, I think it's just a few hundred.
Wow, that
patients.
is a very small number.
Yes, so that is the total registry already.
Wow.
Okay? Yeah,
Okay.
so that is how rare it is.
Okay.
So there are not a lot of studies with hepatoblastoma, to be honest. So I was quite reluctant and really quite challenged when in my approach for BBGN. However, I just pushed through with it. Asked them, okay, why don't you try SimplyNature PPAR agonists? It might help because it has helped the other patients of mine, which are close to liver cancer, because liver cancer hepatoblastoma is classified under carcinomas.
Okay.
So like breast cancer, those are carcinomas as well. So I was thinking probably these have a common denominator in them,
Yeah.
wherein maybe SimplyNature PPAR might work. And then lo and behold, I treated her initially with tablets
Yeah.
and powder.
All right.
Yeah. So with those two alone, treated her for at least a year.
Okay.
So the tumor did not grow.
That's good news. That's the first step
Yes.
whenever and today we are talking about metastasis. So,
Metastasis.
Yeah.
So yeah, baby Jane had metastasis actually.
Already, yeah.
Yeah, already when I first saw her. So metastasis to the spleen and to the stomach.
Okay.
Then the primary tumor, which is in the liver. So when we started SimplyNature PPAR agonist, the metastasis on the spleen went away.
Wow.
The metastasis on the stomach and the intestine went away.
Wow.
So it was just the liver tumor left. Now the liver tumor, we're still monitoring, but baby Gian right now is on her about to finish 2 years already with
Wow.
PPAR agonist. Now, right now she's really well. She's really active. You really won't notice that she is a cancer patient because she's already, how a toddler is.
Yes.
You can just imagine. No?
Yeah.
Yeah. So right now she's still on powder and tablets, but the tumor is not increasing in size already, so it's stable. And her latest ultrasound showed calcifications already. So I'm thinking that maybe they are scar tissues already.
So she might be already clear.
Yeah, she might already be clear.
Perhaps with baby GN, I think it's a really great example as to what gives you the confidence. When we work with oncologists, many oncologists are definitely very careful about supplementation, about taking, definitely very, very cautious about taking anything that's herbal, right? Like your ginseng, your lingzi, because all these herbal remedies do have medicinal properties, and medicinal properties have methods of actions and could be toxic as well. But you're a lifestyle medicine practitioner and you focus on cancer patients. How do you avoid, or how do you give oncologists that you work with in general confidence that what your protocols do not conflict with their standard oncological protocols or even surgery?
I am very careful as well.
Okay.
And of course, when the patient comes to me, I studied their case. I studied what the onco are giving the patient and their plan ahead. Okay, so all of these things I have to take into consideration and plan the protocols that I will prescribe to the patient. However, since I'm a lifestyle medicine doctor, in terms of the protocols that I give to the patient, it's not really that complex. I keep it as simple as possible so that the patients can also follow. Because compliance is really very important as well.
Yes.
If the patient cannot comply, then whatever you give,
no effect.
It won't have any effect. So I know that oncologists have a lot of reservations when it comes to these supplements.
And they have good reason to be, because there are 1,001 new products on the market, and in Philippines and in Asia you have a lot of direct marketing companies, a lot of wild claims, right? A lot of wild claims. So it's right that the oncos are careful. So again, you were saying.
Yeah. Oncos will probably give a lot of these medications, right? So of course we have to study, does these medications have any interactions with the protocols that I'm going to give?
Yes.
In terms of food, not much.
Yes.
Because the patient is going to eat anyway.
Yeah.
The patient should be properly nourished so that the patient can finish the protocol. Because if not, the patient will drop out. And of course, if the patient drops out from the treatment plan, at the end of the day, it's the patient that suffers. Okay? So, how I plan it so I study before. I study the drugs that the onco is giving. I match it with the protocols that I'm giving, and then make sure that the patient can finish the whatever protocol the onco is giving. So that's my approach.
I think that's a really good approach for all the, I guess, I'm so glad that we have oncos watching with us on this Doctors Forum. So I think there are new specialties in medicine, especially lifestyle medicine, which I think is really wonderful, because basically it's a medical doctor level looking at nutritional and how nutrition can be used as a treatment protocol, not just an adjunct therapy. So this gives a really good approach, because in general, many alternative methods have protocols that might actually work against oncological protocols, especially if they have invasive procedures like IV drips and things like that. So for all the medical practitioners who want to develop practices that will flow and support and align well with conventional medicine, our guest today, Dr. Johnson, is really an authority in this area. So if you would like, you can always ask him out for tea, or we will have him back more often and have him share how you can practice supporting conventional medicine, and we basically end up giving patients a second chance, and they do better in chemotherapy. Doc, actually so back to that important question though. In your view, why were SimplyNature PPAR extracts I guess different from your lingzi capsule or things like that? What were there specific things that made you more comfortable with the products?
Well, number one, it's food grade. So
Food grade.
And I mean,
Yeah.
since it's food, I mean, no matter how much you eat, I mean, you won't be poisoned. There won't be any overdose that you will experience. The only side effects that you might experience is better poop.
Better put. That's a side benefit.
Yeah, it's a side benefit. There are a lot of patients of mine who have had experience better bowel movements with SimplyNature PPARs, especially with the extracts, especially liquid. So they notice that their poop is much soft, easier to poop out. That's what one of the benefits that they noticed. And of course, in terms of energy or vigor, they found that they are more energetic. I've actually had a patient who is bedridden, already had first cycle of chemo. However, she did not finish because the side effects were really bad. Breast cancer, stage 4 with bone metastasis. She's complaining of pain all over her body. So I told her, "How old are you?" She said she's 52 years old. My God, you're quite young.
Yes.
And you don't want to finish chemo? She said, "No, doc." Okay.
Because chemo was very bad for her.
Chemo was very bad for her. But I told her, you really need chemo because your case, it's luminal A breast cancer. So with luminal A, ERPR positive, the prognosis is quite good.
Yeah, it's quite good. It's very tailored, well-established, good results.
So
it just happened that she is sort of unlucky in the sense that her reaction to chemo was way worse than a normal cancer patient.
Yeah, so I told her you have to go back to your onco, but don't be afraid of the side effects because I have a protocol that I can give you so that you can survive the side effects of chemo. Lo and behold, I started her on liquid extract.
Yes.
Okay, once a day, one vial, once a day of liquid extract. Her onco started her on IV chemo first.
Okay.
Yeah. So IV chemo, 6 cycles. She finished all. She was scheduled to finish 8 cycles, but her onco stopped it at 6.
Yes.
So the reason why, after just around 4 weeks, she was up and about. She can walk. But
from bedridden.
Yeah, from bedridden, she can walk. She can go to the restroom.
Yes.
And then after a while, she was going to the mall shopping. So I mean, it's really quite
very
amazing.
encouraging, right?
Very encouraging from a bedridden to up and about, then going shopping. I was actually more afraid
of COVID
for her. So since her onco saw that she's really doing well, she even gained weight.
She gained weight. Oh my God. Yeah.
Although of course the other side effects like thinning of hair, there's that.
Yeah, it's still come.
Yeah, it's still come. Nausea, vomiting, not so much, but a little bit. In terms of pain, the pain lessened. Yeah, but there's still pain, so she still has to take pain relievers. But after a while, 6 cycles done. So I told her, okay, so you're done with 6 cycles. Now, we just continue on with the PPAR extracts. So the onco shifted her on capecitabine.
Wow.
Already, oral chemo.
And that's actually the one that we were just talking before the program, right? So maybe this is a good time to segue into our actual topic. Doc, today we are talking about metastatic cancer, and maybe just an overview for conventional approach. When a cancer becomes metastatic, what does an onco do, or what would a surgeon and onco do?
That would be systemic therapy already. So chemotherapy or immunotherapy or targeted therapy. Those are the main treatment modalities that the onco or the surgical oncos will use, because surgery is not an option anymore.
Many times because of the locations.
Because of the location. Because if the cancer is already widespread, then even if you remove the tumor, if you undergo
the other
surgery,
tumors
will
are
spread.
constantly spreading. Yes.
Yeah. Radiation therapy, not so much anymore, because radiation therapy you cannot irradiate the whole body. It's just for a specific part of your body, right? So it's a localized therapy. So you're left with those 3: targeted therapy, immunotherapy, and chemotherapy. Yeah. So the problem there is, since we are facing a stage 4 cancer patient, some of the patients are really weak or really frail.
Yeah.
That's one of the problems. You're lucky if your patient is still quite strong. Yeah, so the prognosis is still quite good. But if they are frail, it's really quite difficult. But nonetheless, they still have to undergo those treatments. However, of course, you as a medical practitioner, right, you'll be asking yourself, wait, if I give this if I give this patient of mine chemotherapy, and the patient is quite frail, will it further decrease the quality of life of the patient, or will it increase the quality of life of the patient?
Yes, because the prognosis of total successful treatment is actually, especially when you hit fourth stage,
Yes.
is in the low double digits for most cancers across the board. So that is a very important question
Yes.
as a medical practitioner. If
Yeah.
we are just so focused on treating a cancer, we might really diminish the quality of life
Yes.
of the patient.
So I approach it in a lot of directions. So not just the chemo. Yes, the patient has to undergo these treatments. However, of course, what if at the back of my mind, hey, what if the cancer of the patient evades the immune system? What if the cancer of the patient is resistant to chemotherapy? Since probably the patient is already stage 4, quite frail, probably there's already a history of previous chemotherapy. Okay, so this, what I'm facing right now is a recurrence. So probably the chemotherapy drug that I'm going to prescribe might not work anymore. Okay. On the other hand, how about targeted therapy? Will it work or will it not? Because on some cases, some types of cancer types, targeted therapy may not work anymore. Okay, so I approach it in a lot of directions. So I use nutrition therapy as well. So food is important. It's very important that the food that the patients eat are of very high quality, and of course they do not eat anything that can promote the spread of cancer or are carcinogenic. Okay, so food is the anchor of it all. Next is I ask the patient, okay, go back to your onco and ask for them for the immunotherapy or the chemotherapy or the targeted therapy, because I have here something, SimplyNature paper liquid extract that can help you finish whatever the onco will give you.
This is the breakthrough we're really talking about, where options that will give the patient a chance to successfully fight their metastasis, but because of patient's health condition, these options are off the table. That's even to the point that even oncos will be reluctant to prescribe. So the alternative that we want to share with everyone here tonight is that you can actually build back the patient's health in a rather rapid time frame. 4 weeks from bedridden to being able to shop, to be able to shop, and that puts the patient in position for chemotherapy again. Doc, before we go back to your patient, maybe a little bit of science. We were discussing a bit that there was a recent research revelation, new research breakthroughs and understanding. You were talking about how PPAR gammas and how that actually inhibits metastasis and tumor growth, and how chemotherapy, specifically the drug that your patient take, actually works in tandem. So maybe you can share with all of us.
Okay. There's a specific signaling pathway, cellular signaling pathway inside our body, inside the cells, called JAK-STAT pathway. So JAK is Janus kinase, so it's an enzyme that activates STAT. Okay, so STAT are proteins, STAT. So when that happens, the end result is cellular proliferation, inhibition of apoptosis. Okay, so it will stop the cancer cells from dying. Okay, so that will allow proliferation of cells, which will end up with cancer. So another one is angiogenesis and the metastasis itself, the spread of cancer cells itself. So if that signaling pathway is overactivated, okay, by inflammatory factors, by cytokines, pro-inflammatory cytokines, then that will happen. Okay, so there are now novel drugs that have been developed that inhibits JAK. So once they inhibit that, so it stops the activation of the STAT pathway in order to stop the processes that I have just mentioned. Okay. However, these are novel drugs which are still in research.
So still in the
development.
Experimental stage.
Yes, there are actually 3 FDA approved drugs already, which are used in other types of cancer, but specifically for solid tumors and breast cancer, they haven't been well established yet.
But the method of action is actually PPAR gamma activation.
Yes. So because we have PPAR gamma already, so I'll go to that. Now, remember this activation, JAK inhibition.
Yes.
Okay. Now, we have PPAR gamma.
Yes.
Okay, so PPAR gamma actually inhibits JAK.
Oh wow. Okay.
Yes. However, in certain types of cancers, especially triple negative breast cancer, the expression of PPAR gamma is actually lower.
Okay.
So if it is lower, then no matter how much agonist that you put in,
Yes.
the end result will not happen.
Yeah. You need an open
Yeah.
receptor
Yes.
to activate it.
To activate it.
Right? Yeah.
Now the problem, so now the researchers are asking, hey, what is happening? Why is it like so?
Yeah.
They found out that if the receptors are low, the DNA is methylated. So meaning, these receptors, imagine them as like golf holes.
Yes.
Okay. So if it's an open hole, then that's you can count the number of golf holes. So it's like 18 golf.
Yes.
18 golf
18
course.
yeah.
So for the 18 golf holes, of course the golf holes are all open.
So
right?
you can play 18
you
holes.
can play 18 holes. Okay.
Yeah.
However, in certain types of cancers, these holes
Are capped.
are capped.
So even though you're on an 18-hole golf course, you can only play 10
number,
holes.
Probably 10 holes, probably 3, probably 5.
Wow.
So you won't be able to play all because they are capped, of course. No? So the end result is, although some PPAR gamma receptors can inhibit JAK, a number of JAK enzymes.
You won't get the full effect.
You won't get the full effect because the activation is not enough.
Yes.
Okay, so what you do is to remove the cap.
Yes.
So how do you remove the cap?
That particular
Capecitabine is a cap remover.
that particular chemotherapy drug.
Yes. So how does it remove the cap? It's because these PPAR gammas, especially in triple negative breast cancer, these PPAR gamma receptors are methylated. The DNA of the receptor is methylated. So meaning the methylation is the one that is blocking capping it. So you remove the methylation. So you open up the hole.
So you get a full 18.
Yeah. So
hole
you get
golf
full
course.
18 holes. So you can now have the PPAR gamma agonist stimulate the PPAR gamma receptor, and you can now inhibit JAK. So yeah.
This is a perfect case of research, new research, giving support to the field results that we see with active patients, right? So we talk about metastasis. So actually, our body's mechanism can be activated through PPAR gamma activation. And if you look at our older videos, and a lot of YouTube educational videos will also show you, PPAR gamma agonists can be created synthetically, but they are also found in natural foods. And SimplyNature PPAR extracts is one of those confirmed, clinically proven, with published research papers that show that we contain both alpha and gamma PPAR agonists and a small number of delta agonists, but primarily alpha and gamma. So this is a perfect reason why it works for cancer treatment. And if you happen to be using the chemotherapy drug, it's actually synergistic.
Yeah, it is synergistic. Now, I'm sure some of our doctors have been using PPAR agonist or SimplyNature PPAR liquid extract for a longer period, for very long already. Some of them might notice that, hey, even though I gave SimplyNature PPAR agonist to my patient, why is it seem that it's not working? So it might be because of this mechanism that I explained a while ago.
So this is very interesting, Doc, because in the medical in the medical field, we really have conventional doctors. Some of them were actually, I know many of them personally. So some of them were disillusioned with their practice of conventional medicine, and they explored new territories, and many times when we explore new territories, we are reluctant to go back to where we came from. But I think if we are patient-centric, what is the irony here is now we realize the natural solution benefits from the pharmaceutical protocol.
The pharmaceutical protocols. Yeah,
So
it really works. It really works well together. It's
So
actually, I would rather have, the patient receive both.
And I think this is one of the things that the doctor forum like this, as I guess part of our advocacy is that we all become patient-centric, and every knowledge and background that you came from then becomes totally applicable and useful instead of going with the new and forgetting the old, right? So if you want to know more about lifestyle medicine and the protocols, just drop us a message. We can always hook you up with Dr. Johnson, or we can invite him for specific topics that you want to learn more about, what kind of protocols you can use to support your cancer patients. And for oncologists out there who do need, I guess, a partner or refer patients who are not able to undergo your chemotherapy protocols because of their state of their health, then Dr. Johnson is someone that I would highly recommend, because as you've heard how he goes about supporting your cancer patient. So perhaps there would be something that you could actually refer patients to him for him to rehabilitate, so that he will send them back to you, because that would be the best solution for your patient. So for oncos that are watching this program and you're looking for a trusted lifestyle medicine practitioner, full MD like Dr. Johnson, I cannot endorse a better person than Dr. Johnson, because I've been working with him for the last 4 years, and I've seen all how he treats patients and the results that the patients got. Yeah, but I guess to cap off today's short interview, what happened to your patient?
Yeah, she was able to finish her. She was able to finish her her protocols, her chemotherapy.
How many sessions did she go for?
Her onco prescribed her with 8.
Yes.
However, her onco stopped her at 6.
Okay.
Because she did really well. Just to have a better picture, no. This patient of mine, initially when she went to me, she had 3 tumors on the left chest. She had two lumps here on the neck, 1 here. So this is on her shoulder, no, supraclavicular area. She had axillary lymph nodes on the left side as well. Then she had multiple bone metastasis on her spine, on her ribs, on her skull, on her forehead. Those are at that point in time, that was her status. So she finished the chemo. Of course, you won't be able to remove everything. The bone metastases are still there. However, the lumps on her chest, all 3 lumps disappeared. The lump on her supraclavicular area on the left disappeared. However, on the right, it got smaller. However, it was still there, no? Albeit a little bit smaller already, although still palpable, but not painful. Okay, so in terms of the pain, from complaining of a pain scale of 8 out of 10, according to her pain scale now is 2.
Wow, that's a huge improvement.
Huge improvement. Previously, when I first saw her, she was on tramadol. So tramadol is an opioid analgesic, quite strong pain reliever. Now she can survive with paracetamol. Plain paracetamol, you can just imagine.
And because of this, she went back to eat all the forbidden foods.
Yes.
And what happened? What's her condition right now?
So, when she ate the forbidden foods, what happened was she went back to me and she told me that her breathing is shallow. So I immediately suspected, probably she has pleural effusion. So pleural effusion is a liquid or water inside her lungs. Then so I asked her, also I was thinking, hey, probably this is COVID. However, is it really COVID? So I asked her, go for a swab test, go for an X-ray. Swab RT-PCR came out negative. And the X-ray came out pleural effusion.
Alright.
Her left lung was obliterated already.
Wow.
So I cannot see an area on her left lung that is irritated. However, her right lung was still okay. So that is good actually. So I told her, you will live, but you have to go to the ER. You have to be admitted for the doctors to drain the fluid. So they were able to drain 5 liters of
that's
water.
a lot of water.
Quite a lot.
Yes.
5 liters of water. All in all, during her admission, because of course when they drain, the water will again refill. So they were able to drain everything. Put her. She was discharged. There was a balloon inserted on her chest. So that balloon was the one that is draining the water for her. Then I asked her, okay, go back to your onco. You have to undergo chemotherapy again.
Okay.
The patient right now is really reluctant.
Yeah.
Because she already had chemotherapy. So I told her, okay, please go back to your onco. Just listen to what your onco will say. If your onco will say that, okay, she will put you on IV chemotherapy, and then you're quite afraid to undergo, then okay, we will respect your wishes. However, her onco decided to put her on oral chemo, so capecitabine.
Oh.
Now, she was on capecitabine already. I put her on liquid extract for 3 months.
Okay.
During that 3 months, actually, it was just a month and a half. The fluid on her lungs stopped filling.
Wow.
So around 2 months already into liquid extract, the surgeon removed the balloon catheter and then closed her up. So right now,
she's getting back on track.
Yeah, she's getting back on track. She doesn't feel any shortness of breath, difficulty breathing. There's also none. She's quite okay. So she finished her capecitabine protocol. Actually, the onco again stopped it earlier because she's doing quite well.
And I think I just want to speak to all the integrative medical doctors who practice integrative medicine. This is a great example, and I would like to meet her onco because, and this is something that we've always wanted, right? That oncos will also modulate their regime, that they will not prescribe chemotherapy more than is necessary. And I think if more cases like this is, highlighted to the public, I think the public would be even more confident about oncological protocols. So I think today's Doctors Forum, I think here's a good spot to end because I can feel that the doctors in attendance today have many questions that they would like to ask. Dr. Johnson, I would really like to thank you for your sharing, and also like to highlight, thank you for the honesty in which you shared about this case study, which I think to all the doctors who practice nutritional protocols, natural protocols, this is one of the difficulties why we can't get consistent results, because our patients don't follow the protocols, right? So we can try to instill lifestyle change, but unless they are restricted into a resort, a health facility, you really can't. And this is where supplementations and extracts like SimplyNature PPARs is sort of like the constant part of your protocol. You can't confirm that they will eat the right foods that you've prescribed, but at least if they're taking the extracts, they're taking the tablets and the capsules, out of your whole protocol, there is one part where the compliance is actually 90% because it's easier to comply. So I think that would help to develop more consistent results for our doctors in attendance, whatever protocols you may be using. And again, I do hope that the oncos and surgical oncos who are watching today will be encouraged. Perhaps you found a solution to your rehabilitative challenges with patients that are too weak. Dr. Johnson will be a great partner for you to rehabilitate your patients, and that you can trust him to return your patients back onto the chemotherapy and back into your care, ready for your protocols. So Dr. Johnson, again, big thank you. I hope you will you will accept our future invitations, and that you will share more with all the doctors in attendance in our next forums. Perhaps a little bit more about your lifestyle protocols the next time. So if that's what you want to hear from Dr. Johnson, just type in your comments right now that yes, you would like to learn a bit more about what are the lifestyle components, what are the lifestyle protocols that Dr. Johnson uses in conjunction with SimplyNature PPARs.